Okay, good afternoon, everyone. Welcome to the FGDP Open Day for the certificate and the diploma programs in Restorative and Aesthetic Dentistry. Thanks for taking your time on a Friday afternoon to listen to us and just learn a little bit more about the course. There's two of us presenting this afternoon, myself and Phil Dawson, and I'll go over some of the personnel involved in it in a second. You will have noted there is a chat section on the Zoom app. So one of you has asked a question already. So as we go along, please feel free just to type questions that might crop up as either Phil or I are presenting, and we'll do our best to answer those as we go along. There will also be a chance to ask some questions at the end of our presentation, and we've also got two of our, one of our current postgraduates and one of our former graduates who are around, who might like to say a few words, and who also may be able to ask questions if you have any direct ones as we go along. So I can see in this question section that Sarah's already asked a question, Sarah, and I will address that in just a moment as we start to get going, because some of that will be included in terms of what I talk about. So if we make a start, so just a little bit of a background of who we are. My name is Nick Lewis. I'm one of the course leads and have been for the last 3 or 4 years. And I'm joined today by Phil Dawson, who's the other course lead for the programme. Both of us have been involved in the programme for kind of in excess of 10 years now. My background is in secondary care, so I work as a consultant in restorative dentistry at the Royal Surrey Hospital in Guildford. My background was at the Eastman in terms of my kind of junior jobs and specialist training, and I also have my own practice that I run with my wife, and so I'm split between hospital practice and specialist practice. Phil also has a wide-ranging scope of work as a general dental practitioner, a foundation trainer, educational supervisor, a regional vice dean, as well as his teaching fellowship at Manchester Dental Hospital. So both of us have got quite a wide-ranging experience in both kind of primary and secondary care. Someone else who some of you may know who is not with us this afternoon is Mike Mulcahy, who's also been involved in the faculty programme since really its inception about 15 years ago. Mike is the chair of our management board in restorative dentistry at the faculty, still working in practice himself, and a past dean of the Faculty of General Dental Practice. And so the three of us essentially run the programme together. Mike was also a course director for about 15 years in the programme as well, so is well versed in what's involved. Most of you will have had lots of contact, I'm sure, with Isha and maybe with Barbara as well, who are essentially the most important cogs in this whole wheel, because without them, none of this runs. And so Isha's kindly set up today just to give you all a bit more of a chance in this funny world that we're in to try and learn a bit more about the programme. We would normally have done this face-to-face, but hopefully this afternoon we'll give you a bit more detailed introduction, put some meat on the bones of the programme, so that those of you that have already applied understand a little bit more about what's involved, and those of you that may be with us this afternoon that are undecided yet have a little bit more of an idea about what the programme entails. So as we move forward, I'm going to speak probably about 15-20 minutes just to talk a little bit about the programme in itself and how it works and what's involved. And I'll hand over to Phil, who's going to give a bit more detail about some of the assessments and some of the important aspects of our case assessments within the course. So if I can start really talking about the certificate diploma programme. So I'll use some of these terms synonymously really. We've run a diploma programme in restorative dentistry, which is a 2-year programme for really the last 14-15 years. Now, last year, we split this up slightly to segregate it into a 1-year certificate programme that then follows on into a 2nd-year diploma programme. The aim of this has always been to provide detailed training with structured days in all aspects of restorative and aesthetic dentistry. And really, the way in which we undertake the learning is a split between didactic and hands-on training. But the real crux of this programme has been obviously that you augment that training by undertaking the work on your own in practice, albeit with help and support from the faculty through the course tutors and the course leads as you go along. So the way that's always manifested, and it did with the diploma as well as now with the certificate, is that we provide you with a hands-on training and a specific tutor to work in a small group environment over the year or 2 years, who can then support and guide you with your casework as you go along. Like any postgraduate programme, unfortunately, we have to assess you, and that means that we've got to undertake different methods in order to ensure that you're meeting the educational needs of the programme. And we'll talk more about that as we go along, because there are a number of different ways that we assess your progress as you go through. And some of that, Sarah, in answer to your question, will come into what we talked about in terms of the eligibility for the specialist exam. So I will answer that question a little bit further on for you. So How does it work? The current model that we're now running is the 1-year certificates that then follows into a 1-year diploma. So in order for graduates to be eligible to move into the diploma program, it is a requirement that you've completed satisfactorily the postgraduate certificates. For those that then complete the diploma successfully, which many have done over the years, there is also scope, if they wish, to then move into one of our articulated programs with an extension to an MSc. So essentially, the diploma program is essentially 2/3 of an MSc for you. Now, we're very fortunate at the faculty that a lot of our kind of sister providers, if you like, with the MSc, pretty much recognise all of the training that we deliver. And so it means that most of you would only have to do an additional year, possibly with 4 or 5 days teaching and then a research project in order to complete an MSc at the end of the course. And so Phil may want to add more of that later on. Now, the MSc is not run by the faculty, that's with our affiliated and articulated university providers, and that can only be done, obviously, after completion of the 2-year diploma program. So lots of graduates will actually apply for the 2-year diploma program from the start, which is great, and the majority of our applicants do that. But in order to progress to that 2nd year, we obviously do need to make sure that they've completed everything satisfactorily after that 1st-year certificate. So previously, and I just to give it a little bit of a background, when we ran the 2-year diploma, this was essentially a 2-year course run, as you can see, with all these different modules here, most of which were run over 2 to 3 days over the 2-year period. And that ran very successfully for about 13, 14 years. And then we made the change last year, which I'll explain why in just a moment. But you can see the makeup of the course is as you would expect for a restorative course, starting with induction and occlusion and perio, and then moving on to the latter units of operative dentistry. And in the old diploma course, we had some special interest unit in perio and endo, and graduates chose which one of those they wanted to do. The reasons that we've moved away slightly from that 2-year diploma program is really to be a little bit more reflective of the current environment for postgraduate education, and a bit more to recognise the slightly different styles of blended learning that now exist. So we were aware that we needed to offer a bit more flexibility to graduates. And so the idea that some of you may want to do a 1-year program rather than a 2, but also the idea that they may wish to do a 1-year program, stop for a year, then re-engage with the 2nd year to move on to diploma, all of which are feasible. We've also found in recent years there's a big variance in the experience of some of our graduates. And when we started this program kind of 15 years ago, the majority of our applicants for the course were probably 10, 15 years qualified. Majority would have been practice owners. And that's probably had a total flip around in the last 15 years. So lots of our applicants now would predominantly be younger dentists looking to enhance their skills much earlier in their career. So again, we wanted to make sure that we were being reflective of that time. And to give you an idea of that, in the last diploma cohort that we had, I had one tutee that was 20 years qualified, looking to, if you like, go back and redevelop skills. And I had another, one of our students who was a registered perio specialist with a PhD working in a dental hospital. And we also had graduates 2 years out of dental school. So you can all understand there's a huge variance in the experience and what those individuals have had. So the movement from a certificate to diploma progression really allows us to make sure that the 1st year, the certificate year, allows us to standardize, make sure everyone is at the same level from an academic perspective before we move into the more specific and more specialist hands-on training in the 2nd diploma year. So our current makeup of the course now is the 1-year certificate course. So that accommodates 7 days over 12 months. So you can see it's an induction day, 2 days of occlusion, 2 consecutive days of perio, an operative dentistry day, and a single day of endo. And that would normally finish, if you guys started the course in September, that would be finishing about mid-May 2021. Now, the observant amongst you will realise I said 1 year, and obviously September to May is not a full year, but that means that that summer period allows you to then finish some of your assessment work. So mini cases, your learning cases that we ask you to do that Phil will talk about later. And so although there's not direct teaching at the end of that 1st year, that fallow time, if you like, to use a current word, is really to allow you to complete that additional work, with the idea being that you then complete the certificate in September 2021. Now, throughout that 1st year, there would be ongoing assessments that we'll talk more about. They would include assignments. So each of the days that you see there would be assessed with a 2,500 word assignment. They're evidence-based. We would talk to you in induction about what we expect with regard to those and how you can find the different parts of the literature and search the evidence base as part of that. And then they're written up as, if you like, a referenced essay that's then marked and double marked by us so that we can ensure it meets the appropriate standard. Now, in addition to assignments, obviously writing essays, we also ask you to do 10 mini cases during that first year. Now, they're pre-prescribed, so after each of these units, we will give you a specific skill that we'd like you to undertake in the practice environment. You then complete that and document it, and then submit that to your tutor for assessment. So if you like, that's a validation of the training that we're giving you. And we also ask you to complete 2 learning cases, which is a more advanced case that, again, Phil's going to talk to you about later on. And so once you've then completed all aspects of that, you'd then be eligible to move on to the diploma year. Note there's no exam for the certificate year, so this is about completing all of the days, attending all of the tutorials, passing the assignments, and then completing the mini cases and the learning cases. The core thesis, for those of you, I mean, Phil and I have spoken to all of the current applicants who've applied, and I think it's important to stress that faculty in FGDP has a long-standing history in kind of minimally invasive dentistry, and certainly the course would look to absolutely support and push that further forward. So it's about conservative management to ensure that we get good aesthetic but long-lasting restorative results. We are very much dependent on reflective clinical practice, and so throughout the course, in all of the assessments that we do, we put a strong emphasis and focus on your own reflection, both about your clinical work now and how it might have been, to ensure that you become a reflective practitioner as well. We want to ensure that there's a strong academic and research base for the work that you do, so that comes about with your assignments, and then also your clinical cases are referenced. But also to make sure, and fundamentally this is what many people want, is to ensure that we can enhance your clinical skills to ensure that you're the best clinical dentist you can be. Now, for those of you that then complete the diploma, obviously the like cherry on the top is the MSc after that, giving you a higher degree, which then often opens a number of other doors, which are helpful to develop your career as a whole. So after you finish that 1-year certificate, and hopefully that's out of the way, majority would then progress to the diploma year, which is different in terms of its structure because it's very much focused on the hands-on side of things. There is a presumption after the certificate year that you've got the academic skills and you're now moving into the more advanced dentistry. So you'll see in this diploma year, there's 8 days that are mandated. You will see again that what's actually on offer here is much more than that. Because when you look at the number of days that we offer, we've got the direct restorative placement, so that's composites, smile design, bleaching, posterior and anterior build-ups, kind of dial approaches, that type of thing. There's advanced perio that would look more into the management of periodontal issues around implants, crown lengthening surgery, some regenerative surgery, mucogingival techniques, and there's a lot more hands-on with pig's heads and surgical teaching as part of that. The endodontic teaching focuses much more on advanced preparation and obturation techniques, would include a little bit more detail on things like the management of trauma, as well as other things that would really sit in the higher levels of endodontic work, such as apicectomies and apical surgery. A removable pros then brings in the more advanced techniques around fixed removable work, maybe milled crowns and things like that. The implant days focuses on restoration of implants, so that's not placement, but again looks to talk more about how you'd be looking to restore simple cases, be predictable, look after implants and maintain them in the longer term. And then the prosthodontic module will then give you a little bit more detail in terms of the different preparation techniques that we'd expect from that higher level. So you can see of all of those days, you'd be entitled to attend all of them. No one has to choose 4 of those 6. You can come to all of them, but we actually only assess you on 4 of those different days. So it's not that you've got to do an assignment on every one of those. You get a chance to pick which 4 of those that you decide to do. In that second year, there are obviously some other assessments. So of those 4, we would again ask you to do some more evidence-based assignments on some of these particular modules. And we'd ask you to do another 4 learning cases. Again, the idea being that in that second year, you've then had a chance to develop more cases in the practice so that you write up some more detailed cases in addition to completing some more mini cases as well. So you will see we are assessing you as we go along the whole way through. And again, lots of people, some of you may ask as we go along about the assessment and how scrutinizing that is. The reason that we have such a good relationship with our masters providers is because we assess you that way, because in order for those universities to recognize all of this learning that we provide you, they've got to ensure that it's been validated through assessment. And so that's the reason that we have quite stringent assessment processes to ensure that we do that throughout the 2 years of the course. Now, added on to this, as many of you will have spoken about with Phil or I when we've had chats, the tutorials form a pretty fundamental part of this as well. And so normally, and I asterisk this simply because of the world we're in with COVID at the moment, But normally speaking, on the Friday evening before the academic days, we would normally meet for a tutorial before the study day. So that would normally encompass feedback from the last assignment. So you get a chance to understand what was expected and how everyone did, and if there were any things that people missed. And so you have an idea of appropriate feedback with the assignment. And then we would split the cohort, your group, up into usually groups of 4, 5, 6 people. And then you have a nominated tutor that you then sit with and go through your cases. That's informal, it's not adversarial, it's not a viva, it's literally you sitting with a small, consistent group of people so that you can go through cases. And it might be a case that you don't know what to treat, how to treatment plan. It might be one that you've started but don't know how to progress with. And you bring models and radiographs and clinical pictures so we can then treatment plan those in that small group environment over 2 or 3 hours. So for me, that's an incredibly fundamental part of the course. It's essentially giving you a restorative mentor for that 2-year period so that all of your cases are kind of run through not only the guys in your group, but also with an experienced colleague who can give you guidance about work up the diagnostic stages as well as the completion of the treatment. So for you guys, those Friday sessions would normally involve reading lists, making sure you've done your course preparation, making sure cases are worked up to discuss, and then knowing what you want to raise as priority with that. Now, the asterisk for the COVID time that we're in is only really that tutorials all need to be delivered. So what we can't do, and we've talked about this as course leads, we don't feel there's really scope to run tutor groups remotely. We think it needs to be face-to-face. That will be dependent on social distancing, and the likelihood would be that we run tutorials in regional areas to minimise the amount of time that everyone can travel. Appreciate that might not be possible for everyone to not have to travel too far, but the idea of that is that we continue to meet face-to-face, and that's an important fundamental in terms of the course. So other things that you would be looking at, so just to summarise on this really, we're obviously throughout the course look at the didactic sessions of the academic teaching, and that's augmented then by the group tutorials. The idea then is your group learning and your work-based learning is then taken back to practice so that you can undertake those different items of treatment such as the mini cases. And then over the 2 years, you then got quite cohesive and interactive group treatment planning over that period with your tutor groups. What I have to say the course isn't, is it, we can't spoon feed you. This is a postgraduate course. It's about you guys being self-starters. You need to do your self-directed learning, get the assignments done and get the cases prepared as well. But I would hope that at the end of this, we would expect all of you to have a much better evidence-based approach to restorative dentistry. We would absolutely hope at the end of the diploma program, we've augmented your hands-on and your clinical skills. And I think the big and most important thing for me is, the idea here is not that you're applying for a certificate or even a diploma, but actually this is an incredibly cost-effective way of doing an MSc program. And we may have a chance to talk to Dan Char, who's with us now. He's one of our MSc grads as well. He's did the program a couple of years ago and is now doing his MSc. So that's a huge benefit to be able to finish the program and move fairly quickly into the MSc environment. So I'm not going to do too much about assessment because Phil's going to talk about that in a minute. And I've touched on the assignments that we've done and the mini cases that you then do over those 2 different years. I think the important thing to say with regard to the assessment is that from a point of view of how they're marked, all of the cases would be marked and a number are then double marked. So if you were not successful in completing an assignment, there is always scope to resit that. You're not penalised for that, although the reassessment is capped at 50%. But more often than not, that's very often when people have just misunderstood a question or done anything like that. I'm just looking, a few questions have popped up, so before I carry on, I'm just going to ask those. Sarah, I'm going to answer your question in a minute, so I'm still going to pause on that one. And there's a question here about how many face-to-face sessions are we looking at in the first year? So the first one of those, so the face-to-face sessions in the certificate year are really all going to be the tutor groups, of which you'd expect to have 6 tutor groups in that first year. The induction day, which is planned for September, we are still intending to run as a face-to-face session. The reason for that being that we all think it's quite an important thing for everyone to meet, and presuming the current restrictions with respect to COVID continue to be lifted, we are confident that we'll be able to run a normal lecture day for that induction program, which would include a short tutorial as well, so you can understand almost the terms of reference with regard to that. But then during the course of the remainder of the year, you, your tutor and your tutor group would then look to meet around 6 times in order to have the face-to-face time to plan your cases over that 12-month period. Ron has asked a question, does the course require the candidate to currently be practicing as a GP? You need to be registered wherever you're working to be a GP. And the reason for that is that some of the mini cases and assessments you wouldn't be able to complete if you weren't a practicing dentist. So I think the probable answer is yes. I suppose on top of that, the next question is, do I have to be GDC registered? Well, not really, because you could live overseas and easily complete the program as a practicing dentist, albeit not registered with the GDC. And we have had a number of graduates from, I can think, Denmark and the Philippines who have come over and undertaken the course in recent years. And they've been able to complete everything without a problem because they're practicing dentists, albeit not GDC registered. And the final one is there any preparation we should be doing now for the certificate year? No, not really. I don't think there's anything you need to do in advance for the certificate year. I'd have a rest is probably what I do, because there's going to be some work to be done next year. So just to finish my last couple of slides, really in terms of what I would hope the course give you before I hand over to Phil is enjoyment of a new group of colleagues, obviously like-minded colleagues that are interested and keen to do postgraduate work. Certainly confidence in treatment planning and the execution of more advanced restorative work is a common thing, a sound evidence base. And as I've said already, this kind of, I think, real caveat of doing the MSc is a really important part of that as well. And again, I think a unique opportunity. Lots of our graduates are, in terms of progression of the course, and this is going to take me back to Sarah's question in a second. I think the MSc should be the focus of all those that go through and do the diploma programme. Common changes that we do see in terms of clinical practice: we would see lots of our grads start to undertake the management of more complex cases. We would see a lot more tier 2 work for those of you working in the NHS. And we'd also expect to see a number of people might start doing more private dentistry, and that's not a common thing. That's not an intention for us, but that's probably a natural progression for lots of clinicians. Others who then have gone on to do the MSc would look at things like hospital-based teaching appointments and maybe increasing their kind of foundation dentist input and educational provision as well. So they're the type of things that lots of people will tend to progress to after completing the course from that perspective. Just before I do hand over to Phil, other things I would just touch on. I mean, FGDP would obviously support you throughout all of this. Many of you will be aware that in the next year or so, we would expect FGDP to morph into something different. And you'll have seen earlier on reference to the slide of the College of General Dentistry, because FGDP is redeveloping itself in that regard. You guys are slightly unique in that it's not impossible that for those of you that sit the certificate programme, that you would complete the certificate in restorative dentistry through the faculty. That would be an FGDP award. And then if, as intended, next year the College of General Dentistry commences, your diploma year would probably then be awarded in the first year of inception of the College of General Dentistry, and then potentially going on to the MSc after that. So I think that's kind of a unique situation that you guys might find yourself in. So my final slide before handing over to Phil, and this is really just a caveat, some of this has already been discussed with others, is just the mitigation, if you like, for COVID and where we are now. So again, I know I've spoken to some of you about this, I'm sure Phil has as well. So the remote delivery has been fortuitous for us as FGDP, because we'd already planned the certificate year to be predominantly lecture based. So that is helpful to us because actually it lends itself well to being able to deliver lots of our educational content for the certificate remotely. The DRD year has to be delivered hands-on. So our current cohort that are in that are still going to have hands-on dentistry. Again, we've been lucky that COVID has hit at the time it has, if we can say it that way, because there wasn't actually any planned hands-on delivery for that time. So within COVID, since lockdown, since the end of March, our current certificate year have had 2 of their units delivered completely remotely. And that was for the endo and the operative dentistry units. The only part of that, they had remote tutorials to try and catch up on that. But Phil and I both feel that in the longer term, tutorials need to be face-to-face for that, if you like, press the flesh contact, and to give you the kind of the detail that you get with looking at cast and things like that. So it would be our intention that the CRD is predominantly lecture-based and deliver it remotely, accepting what we talked already about with induction, and depending on guidelines, possibly the occlusion module would be a second module that we'd like to try and deliver face-to-face if current guidelines and the government's recommendations in terms of distancing and things has been alleviated. We've got time till that, because that would potentially be January, March of next year. What I would say about tutorials, and Phil may touch on this in a minute, is that they'll be planned at regional centres around the country to minimise everyone having to travel to London. So it may be that we have one further north, one further south, just so that we can minimise the amount of travel that people have to do regarding that, especially for that tutor group training. So I hope that's a helpful summary really of what we've got. Sarah, in answer to your question about the MRD, so where people go from this, the program would absolutely sit as part of eligibility for MRD or MPROS, for example. The MSc would probably be a very important part of that, because if you could evidence the certificate, diploma and MSc, that would sit very comfortably for you then to potentially to apply for the MPROS exam. That normally requires sign-off from an academic tutor, so someone like Phil or I or Mike Mulcahy. But this is the type of thing that absolutely would be looked at by the colleges, because it's a recognised postgraduate award, and obviously the MSc being a higher degree would also sit within that as well. So all of that is something that you could consider if that was your intention in the longer term for you. And I hope that answers your question. So I'm going to stop screen sharing now. Phil, I'll hand over to you if that's all right, and I'll stay on, and obviously we're both around to answer questions at the end as well.
Okay. Hi, I hope everybody can hear me. Nick, can you hear me okay? Yeah? All good. Okay. Hi guys. As you may or may not know, my name is Phil Dawson. As Nick alluded, my background is primarily in primary care dentistry. So pretty much like yourselves, I was embarking on this course, I guess it'll be 12, 13 years ago. I think I was in the second cohort. As Nick alluded, the cross-section of candidates is massively different. When I was there, I was probably one of the younger ones, and I was then probably in my mid to late 30s, practice owner, whereas now we've got a huge cross-section, and including some, what I like to think, some very young dentists, including Emily, who will be with us later, and she's currently doing the certificate, and she was my foundation dentist as of last year, so she's freshly out, and I'm sure you'll all have loads of questions for both herself and Daniel, just to give you an idea of how it is run now. When I did it, as I said, 2008-ish, when I completed it, I did the MSc, and I have to say, it's not over the top to say this, but it did revolutionize my career. I know, Amina, you're listening into this. I met a few of you at Manchester, and I would not have been a tutor at Manchester had it not been for this course. There are other courses around, of course, and it's up to you guys as potential purchasers of CPD material like this. You do need to shop around, but it's my earnest belief that you'd be hard pressed to find something that doesn't marry the evidence and the theoretical side of dentistry with the practical side that we all use each and every single day. Okay, so I would just like to oops, go back one. I have a very, very sensitive mouse, so I do apologize in advance if it starts misbehaving itself. We are very keen on having a very high level of theory, but without disappearing up our own derrieres. It's very important to us that this is always aligned with the practical element of dentistry. And after all, the vast majority of dentistry is practical. We will be looking at the certificate assessment. There will be 5 assignments in total in the year of the certificate. The 10 mini cases, we'd expect the submission of 2 what we'll call learning cases. And then once you progress to the diploma in the second year, there'll be, you'd expect to have completed all of the study days, all of the tutorials, attendance at them, assignments, and submit the 2 completely fully written up cases. The tutorials, it's a little bit of a cliche, but seriously, you do get out what you put into the tutorials. They're an immensely enjoyable part of the course, and there's a lot of rich learning to be taken. And some of the best tutorials I've been attended in are when I shut up and I don't have to say 2 words, and the tutees are just discussing it amongst themselves. That doesn't happen for the first tutorial or 2, but it's really pleasant when it does. So the assignments, we'll call them assignments. Some people think they're essays. Some people think they're absolutely hideous to do. But we're looking at 2,500 words referenced. And the key to this is it's at master's level, okay? Which means it has to be evidence-based and researched. We do assess it, but it is, when I did the certificate diploma, it was probably the biggest area where I took learning. The assignments themselves at master's level, we're not A-level students any longer. We're not undergraduates. So from a master's point of view, and on induction day, I'll probably bore the pants off you with some of this, because I am very nearly finished my master's, my MA in education. So we will be giving you support in how to write, as well as how to resource and access the relevant literature. But the master's level really it's all about your opinion, okay? It's your researched, balanced opinion. So, for instance, if you're looking at an opinion or something to do with the restorative dentistry, you're looking at party A's opinion, you reference it, you'll be then looking at party B's opinion, referencing it, and then we would expect you to develop your own opinion on that, okay? It's not just about verbatim writing out and answering questions. We want opinions, and those opinions have to be evidence-based. So for instance, if this is one of the top, potentially one of the assignments, so define working length in endodontics, relating it to the local anatomy. So yeah, that is pretty theoretical, okay? What is the local anatomy? What are we going to measure it to? Okay, and what is the working length? Where do we assess it to? The radiographic apex, the anatomical apex, where? Then we're asking something personal. What is your protocol? What do you do at the moment, and how do you prepare to this length? Then we want to know what the consequences, is it relevant? Why do we have a working length? What are the consequences if you don't achieve ideal working length? If you go over through the apex, or if you go under, okay? And how might that actually affect the outcome or the success of the root canal process? This, of course, has to be used, a reference and using an evidence base. So in that one particular assignment, you will see that there's a mixture of theory. It's not just blind ivory tower theory. It's focused on ourselves as practitioners. Why do we need to know what the local anatomy is? Is it important? If it is, why is it important? And then very, very crucial, you need to answer that. What is your protocol? And if your present protocol is wrong in the light of how you defined working length and the consequences for overextension or underextension, then we would expect in a reflection part of the assignment to explain why and how you may change. And reflection is going to be a massive part, not only of the assignments, but of the whole certificate process. Along with those assignments, we're expecting mini cases. Now, there'll be 10 in total throughout the year. Some call them mini cases, some call them learning events or mini learning events, but we used to not prescribe them as such. We used to leave them up to the candidates, and certainly when I did the certificate, it was left up to me what I decided. So we used to get a whole cross section. We now try and focus it a lot more on the study day. So you will have some learning on that study. You'll be given some new skill on that study day. We're then going to ask you, well, after that, show us that you've taken that skill on board and you're now using it in your practice. So again, it's taking theory and putting it into practice, because as Nick said, we are the Faculty of General Dental Practice. Soon we may be changing, but it's still College of General Dentistry. So it's all about getting into practice this new theory that you've learned. There will be 10 prescribed procedures. The one, for instance, will be the construction of Lucia jig. I'll go through one in particular in a slide or two, but they're all important topics, and they're all important skills, some of which you may already have, some of which you may be acquiring new. They all will have, I promise, they will have a direct relevance to general practice. And if it's not to your general practice as of today, then it will certainly be directly relevant to general practice as you will develop with this diploma, with this certificate. Typically, it's not difficult, 2 or 3 pages, that's all. And I'll show you in a second one. but it's not designed to be challenging. It's just designed to showcase your learning. It gives your tutor an opportunity to see how you've learned, and very often they're not marked as such, they're just assessed as completed. So we may have a tutor who would bounce back some thoughts. Why didn't you do this? Why did you do that? And then you'd answer that, and then eventually the tutor will be happy, and that's signed off and completed. They're not onerous, I promise. Just to prove, this one is from Emily, who's a current certificate. On one of the perio days, you taught the art and the importance and the science and the research and the evidence behind the effect of tip-top oral hygiene. Does oral hygiene instruction alone, does it have any effect? Okay, if we remove that or disturb that biofilm, what effect does that have? Okay, so a mini case you're given, and that's just one pre-op photograph. And this is literally as the patient walks in the room. You've then spent time only giving oral hygiene instruction. You do no professional cleaning at all. It's just the effect of giving the patient the ability of cleaning the teeth effectively. You're giving them those skills. 4 weeks later, in they come. And that's how they turn out. Yes, it's not perfect, but compared to day one, it's pretty impressive. There's a significant amount or reduction of inflammation. There's still some subgingival calculus around, obviously there's a lot, but the actual plaque score is way, way down. You will be taught the theory that now we've got a fighting chance of turning this patient around and getting them from that to something a lot more healthy. There are two photographs, before and after. That is the write-up. Basically a quick discussion, what we did, what went well, what didn't go so well, and a couple of references. That, I've just noticed Emily's just joined, she's probably embarrassed now, but that was a very simple, very straightforward learning case, which showed exactly, not only that she'd learned, but also putting it into practice, putting it into effect. Okay, no treatment, no active treatment. So we'd have 10 of those, okay? Not difficult, they will be pre-prescribed, and they are designed for you to showcase your learning. We've got two major cases in the certificate here. You guys will be provided with a template, which is on the VLE, and we will be marking them, and you'll get a lot of feedback. The template that's provided is there, so please do not reinvent the wheel. The template is there because we want you to follow that, because it's tried and trusted, but we occasionally do get people who, for some bizarre reason, want to make life difficult for themselves and reinvent the wheel and give us another template, which in itself is not necessarily a fail, but why be awkward? Why be difficult? Why make it awkward for yourself? There's a lot of learning on just the presentation of the case. So we make it the initial case, the treatment, you do not have to be too complex. I know some of the Manchester graduates, your cases that you would have presented at finals will be more complicated than some of these initial cases. For instance, we might have a little bit of perio with a molar root filling and provision of a fixed restoration, okay, on that. It's mostly to do about getting it right, and getting it right to our standard, and getting into that thought process where we have a full comprehensive H&E, cover everything, drag in everything, even if it might prove not to be important or relevant in the particular case. We want to gather as much evidence as possible. And again, it's a learning curve. Some of you will have this already. Some of you will be learning it as we're going along. And this is how we learn it in the major cases. That will then lead to a list of provisional diagnoses, which we want you to assess all of them. Then with your special tests, special investigations, you will rule out or confirm some of those provisional diagnoses into definitive diagnoses. Those once we've got the definitive diagnoses, that will then lead to your whole list of treatment options, which on discussion with the patient and assessment of prognosis will lead to your treatment plan. Very straightforward, very simple, but the template that we provide gives you, it's a very straightforward, very obvious way of completing the treatment or arriving at the treatment plan. It's very, very important that we have the evidence base around each decision, okay? Your special tests, why do they work? Why do we use this special test? And it'll be referenced. The majority of it will be obviously referencing when it comes to the definitive diagnoses leading to treatment options, which will also lead to the treatment plan. Then we'll talk about treatment execution, and you'll be showing us exactly what you did and how you did it. So with photographs, copies of radiographs. We always like at the end a discussion and also reflection. Reflection is going to be huge in not only your assignments, but also in your treatments and your major cases. It gives you but it's not there to say, well, I took the wrong tooth out, but hey ho, I promise not to do the same again next time. Reflection is all about, well, what minor things may or may not have gone well, what minor things did go well, and it's your reflection on that. What will I be doing differently? Why will I be doing that differently? Where's the evidence for me to be doing it differently? Okay, and that is in essence what the learning cases, i.e., are about to, again, to display and to showcase your learning. Again, the diploma itself, we have 4 2,500 word assignments of the chosen modules. I think Nick mentioned out of all those modules, you'll have to choose 4. You're free to attend them all, but you'll choose 4, and those that you choose, and you will be choosing them up front. Those that you officially choose will be the ones that you're expected to write your assignments on. Again, it's another 10 mini cases, but this time you're allowed to choose the topics yourselves. We would be expecting 6 cases in the diploma year. That goes what Nick was saying about being much more hands-on. So we're looking at 4 more learning cases. And it's, again, a step-by-step progress. You've done your 2 learning cases in the certificate year. The first one, very, very simplistic treatment. The second one, again, a little bit more, but it doesn't have to be massively extensive treatment. Then when we come into the diploma year, we're looking at a progression through those 4 learning cases up to full mouth rehabilitations, but you will be supported and you will feel that that's a natural progression. I know certainly when I did it, if somebody had told me on day 1, I would be capable of turning out work that I later presented for my exam, I would have thought they'd been on the laughing gas. But it's a cliche, but small steps, you do end up doing the marathon. You will get there. And after those 4 learning cases, we'll be looking at you presenting an extra 2 for the exam. Okay, that's for the final assessment. And to be awarded the diploma, you have to have the certificate, obviously, but you would expect you to have completion of all study days, all tutorials, all assignments, and there was 8 in total fully completed and written up cases. And then you'll be examined and assessed on the 2 in the final assessment. Nick, that is me done.
Thanks, Phil.
Just coming off, I noticed Emily has joined us, and
Dan's there as well, I think. What we might do, without putting Emily too much onto the spot, it might be helpful just to hear briefly from Emily and Dan, if possible. Emily, can you hear us okay?
Hi.
Hi.
Yeah.
Thanks for joining us. So I just wonder if, I'm going to ask Dan in a second as well. So Phil and I have obviously gone through the content of the course, but it's in our vested interest to say that something's good or how it is. So you're in the guts of this at the minute. So can you give us a little idea of how you found that this year? Appreciate the COVID hiatus, but tell us a little bit about how you found the course.
I mean, at the beginning, I found it really useful. It was good coming to London and meeting other people on the course as well. And you're in little study groups as well, which you have a tutor overseeing you. And that's quite good that, like, our study group has our own WhatsApp and we message things through that. So you've got the support of not only the tutors, but other people on your course as well. But it's been good how each weekend that we go down to London has been separated into really distinct topics. So you cover each area really clearly, and then you go away and you can put that into practice with the mini cases or into your other clinical time, and you'll have an essay based on that single area. I found the essays really beneficial. I feel like despite having the days where you're in London and you've got someone teaching you, which has been really good, the essay side of things, doing all the research and reading up on everything yourself, has taught me an awful lot as well. But yeah, it's been good that you get in-depth knowledge from people who are at the top of the game in this type of field, and it's just trying to take on board as much as what you possibly can to put into your practice. But yeah, it's been good.
Emily, can I preempt and just ask how, because you started going to London and then it obviously COVID struck.
Yeah.
And how, honestly, how has the transition to remote teaching affected you, would you say? This isn't a pre-arranged question, guys, so I'm a little bit nervous as to how she might answer this. Answer honestly.
I mean, I personally prefer coming to London, just for the fact of the social side of meeting other people and having the help of other people and being there in person. But I can see the benefits of doing it from a distance. Obviously, you've not got the added expense, and you're learning the same thing essentially. So you're still getting the knowledge, and you're still doing everything that you would do if you were in London. But I do quite like coming to London just for the weekends as well.
Possibly because you're a bit of a party girl, though.
Potentially.
I can say that, guys, because she was my foundation dentist last year.
Emily, thanks very much for that. So moving on, Emily's obviously just finishing the certificate year now, so it's helpful to hear that. And thank you for joining us, Emily, in that respect. And then Dan Char's on here as well. So Dan was in my tutor group, more pity him. So he finished the diploma last year and is now just finishing off his MSc through. And so hopefully, Dan, can you hear us as well?
I can just about, yeah. Hi, everyone.
So Dan, just to take that step forward, so having finished the diploma, I appreciate, I mean, the teaching was the same, albeit slightly different structure. Can you give the group a bit of an insight into how it changed your practice? I know it has changed your practice, but also how you then articulated that into the MSc.
Yeah, sure. I think the course really allows you to get confident with taking on more complicated cases. And as you do take on more complicated cases, you have to obviously write treatment plans out and treatment letters to patients, and you have to be able to talk to patients about the different types of techniques that you're going to be employing to be able to provide this treatment for them. And everything that the course provides and asks you to do regarding assignments really benefits you when you come to use these skills to talk to your patients about treatment plans, and you gain confidence in firstly being able to talk to them about it, and secondly being able to actually provide the treatment for it. The course has been fantastic. It was fantastic, and it's definitely changed how I work and the type of dentistry that I'm doing now. And I started the course definitely looking to do an MSc after, because we've practically done, I think, 2/3 of an MSc when we finished the course. So it made sense just to carry on and do the course, do the MSc. So I applied to Kent, which was really quite easy to do in terms of the application, and just took what I learned in terms of critiquing the literature to apply that to an MSc project.
And just moving on with that, Dan, so you've pretty much done the 2-year diploma and you followed that onto the MSc straight away, didn't you?
Yes.
Yeah.
Yeah.
And then just, if I can just ask one other question, just going back to your scope of practice, because you predominantly, before the diploma, worked predominantly in NHS practice?
Yes.
And then just in terms of your scope, and clearly I know the answer to this question, but it's really for the benefit of the guys here, but tell us the type of cases that you're now treating. You talked about confidence, but what type of cases would you now expect to treat with hopefully more ease than you may have done before the course?
Okay, so I really enjoy treating tooth wear. And I think if you can reorganize an occlusion and restore a worn dentition, I think you can do a hell of a lot in dentistry, not necessarily touching on implants, but using everything that the course taught you. I do a lot of tooth wear. I try and do a lot of tooth wear cases, but I do more complex fixed removable pros cases using mill crowns and precision attachments, and also more complicated endo, which I really enjoy doing. So some retreatments, some post removals, fractured file removal I've also done as well, and the course really teaches you all of those aspects of dentistry that you can employ straight away into practice.
Daniel, are you still, is that all those procedures on your own patients, or have you started to receive any referrals?
So I get referrals from within the practice, including the boss refers to me now.
Yeah.
Yeah. And
that's after literally just completing it last year?
To be honest, that was, so when did I think I finished 2018, 19. And so, yeah, and then went straight into Kent to do the MSc. I was getting referrals during the course as well.
Yeah. And you expect that referral base just to grow?
Hopefully, yeah, hopefully. Just seeing how COVID influences general practice might be an interesting thing, but hopefully, yeah.
Dan, thanks for taking the time. I know you're on leave this week, so I appreciate you taking the time just to share your own experience with everyone as well. It's much appreciated.
Pleasure.
I know there's a couple of other questions on here, guys, I haven't answered. So just to make sure that I'm addressing those. Zara had asked a question about entry requirements. So just to retouch on what I mentioned earlier on, obviously you need to be a practicing dentist because you need to be able to undertake the mini cases and learning cases on patients. When we do some of the modules such as occlusion as well, it may be that you examine each other. So again, you would need to be registered with regard to that in the UK. If you were overseas, again, you need to be a practicing dentist to be able to undertake the work. So that wouldn't preclude you from doing it. And obviously overseas graduates just mean they've got to travel a bit more clearly. But aside from that, that wouldn't be a barrier. And as I said earlier on, we've certainly in recent 3 or 4 years had a graduate from the Philippines that's done the course, and 2 graduates from Denmark that used to come over and have done it all that way as well. So it's not an issue, but clearly majority are UK based and GDC registered, but that's not an issue not to be, but you do need to be practicing. So I hope that answers that question. With regard to your second question about the study, is it available online? So that's a good question about the online learning, which was touched on a little bit by Emily. And so all of the webinars are recorded. So we've delivered, obviously, the certificate, as Emily touched upon, this year for the last 2 modules. So they were, it's not Zoom, it's a different virtual learning environment that we have. We have a separate platform, but the graduates would dial in like you guys are doing now. You can ask questions during the day. The lectures are given to you. Phil and I are around, so we're asking questions and raising issues as we go along. So it's a similar type of thing as you'd have face-to-face, albeit sitting remotely. It's then recorded for 14 days, so you've got a chance then to go back into it and dial in afterwards. I know one of the questions from one of the potential applicants who's Australia-based actually, which I think would be our record in terms of travel for the diploma from Australia, but he asked about the time zone. Vishal, so I hope this answers your question in that it's recorded. So if you couldn't attend the session, say on the Saturday, there would be nothing to stop you watching it back afterwards, so that you can get the education that way. You don't get the live element of it to ask questions, but it does allow you to do it separately. I think the tutor side of things can't be done separately. Obviously, that's a face-to-face thing. And as we touched on earlier on, because of our regulations with the MSc, it is a requirement that you complete all of the required teaching. So that's all of the online study days, all of the tutor groups, the assignments, the mini cases, the learning cases. All of those contribute to a number of academic hours that we are required to submit on your part to validate that you've done the teaching and the training and the work-based learning. So if you don't do some of those components, you wouldn't be eligible for the award of either the certificate and or the diploma. So that's an important thing to stress. You do need to complete all aspects of the course, as Phil touched on. So I hope that answers your question. there is another question. Scott, you've asked about a standard of treatment that you're able to follow out after the course. Would it have any impact on the stat that you filled options? So that's a really good question about the different standards of treatment. So obviously, I mean, Phil might want to comment on this as well. I mean, I would say certainly in the time I've been involved in the course, about 11 years now, and I would say I don't think experience necessarily changes what you're able to do after the course. And I would say that because I can think of tutees that I've had who were much more experienced, but they'd learned a lot of bad habits and they almost had to go backwards before they could go forwards. I think one of the advantages of younger practitioners, and if I can say this nicely, is that you haven't had a chance to develop quite so many bad habits. So very often your starting point is more contemporary anyway, because you've undertaken lots of your undergraduate work more recently. Clearly there'll be some guys that have done a lot of postgrad, and I mentioned that it was funny, this is a funny anecdote, but the lady I referred to earlier on, she was a perio specialist, she'd done a PhD at the Eastman, and she sat in the perio module, and her PhD thesis was actually put up as reference as a good study to look at about periimplantitis results. But the speaker, poor guy, didn't realise that the author of that study was actually sitting in front of him as one of the lecture delegates. So I don't think experience necessarily means that you will definitely be able to do more. Dan would have been within 3-4 years of qualifying when he did this course. So I don't think that would affect that. I think it's more about you, clearly the environment you work in, obviously how you progress with the hands-on element and your confidence and how you then feel you want to take patients forward. But that does come down to individuals, because clearly people are different in terms of what they wish to do or what they might be more concerned about doing. So I hope, Scott, that answers your question in that regard. Phil, I don't know if you've got any comments from the foundation side of things.
Yeah, you covered that really well, Nick. The limiting factor, if there is one, wouldn't be your experience, Scott. I think it's more likely to be your pool of patients. So if you've got a relatively smaller number of patients on your patient list than, say, an experienced practitioner would have, then that might limit the ability or the availability, I should say, of potential cases. But any high street practitioner will have more than sufficient types of patient. We are here, as Nick says, to deconstruct bad habits if they're needed, to then in a supportive way reconstruct. The younger guys, you haven't had an opportunity yet to learn those bad habits, so we are there to help, to guide and to support you in that step by step until you feel more confident. We would never expect you to operate outside your sphere of practice, but with us and the skills and the theory you will learn, and probably the most important thing is learning that evidence, which gives you confidence then that, yes, do you know what? My resin bonded bridge is going to work because I know the evidence, I followed the guidelines, it will work. And with that confidence, that then spreads throughout your practice, and you will then feel more confident taking on more and more difficult cases. Hopefully, I think that might ring true with Emily and Dan, that step-by-step process, and we are here to help guide you. Providing you've got that pool of patients, Scott, I don't see that lack of experience is a limiting factor at all.
So Scott, I hope that answers your question. There are a couple more. One is a really quick, easy one. So someone's asked about the list of universities that we articulate with regard to the MSc. So there's been a number over the recent years. So originally Leeds and King's were the main two. That's probably changed slightly. The majority now, I would think, where, I mean, Dan alluded to the fact that he's doing his at the University of Kent, where Mike's a professor there, Mike Mackay. So we've done a lot with Kent. Peninsula would be the other one. They pretty much recognise all of the training that we provide over the 2 years. Every university is slightly different because they have to look at the course we provide, and there's something called APPLE, which is the approved prior learning. So they have to look at how we assess you and the teaching we give you and recognise whether or not they would accept that as part of accepted learning for their MSc. But certainly the majority of our grads now would be looking to do their MSc through King's and Peninsula. King's can still be done. One big variance is course fees for those MScs. We don't have any control over those because they're not done by FGDP. So to give you an idea, King's would be at the upper end. I think it's probably nearly 15,000 for a single year MSc with King's, which is considerably more than the options of Kent or Peninsula. And because they approve the majority of that prior learning, the additional course fees for the MSc year with them, I think, is about 4,000 to 5,000, to give you an idea, which is obviously a considerable difference when you compare that to King's. In honest truth, the MSc year is similar in all three of them, because you're essentially being given the tools that you need in terms of evidence-based dentistry to do a research project. Phil, you're probably better placed to talk about that than me, actually.
Well, yes, I did it at Leeds, and we had, it was the first year it was run with the MSc bolt-on. Unfortunately, lessons have been learned, and it's not quite as heavy going as it was when I did. I remember we did a statistics module, and these guys were talking about multi-level modelling. We were sat in this seminar. There was probably 5, 6 diploma guys sat with. I was sat next to this guy who was doing a PhD in applied statistics, and he was on this seminar with us, and we were being treated, as equals. And to say it was over our heads was just nonsense. But I think Leeds certainly learned, and I know for a fact that Peninsula aim it just purely to give you the statistics knowledge that you will need to support the writing up of your research. So a lot of it is distance learning as well. So you think Peninsula, gosh, that's at the other end of the country. It is distance webinar learning as well. So it's not that difficult. I can't really see the point in anybody doing just the diploma, because it's 2/3 of the MSc, but it's by far and away the difficult 2/3. The final third of completing it, it's just such an easy cherry on the cake, and it's enjoyable, but it just makes such a difference. You've done all that hard work, you've done the sweat. It's like, to me, it was like running a marathon, and the last part of a marathon, if anybody's run one, originally Olympic marathons, is in the stadium. So yes, you've got to run around the stadium, but that is equivalent to the MSc. You've done the 26 miles in your certificate and diploma. Why not finish it off by a little jog around the stadium to get your MSc?
One other question, Phil, we've got is just about the faculty provision of resources, articles, and textbooks. Forgive me, I don't know. It's an anonymous attendee, so I don't know your name. Just in answer of that, Phil and I would cover that in the induction day, which again, we really want to run face-to-face. And this is a really important question with regard to that, because that day is about the course, the structure. We normally have Avi Banerjee talking about minimally invasive dentistry, and he's normally fantastic in terms of his ethos around the course. We would talk to you about cases, about tutor groups, but more importantly, we'd also go through how we would expect you to identify evidence for your assignment. So we would give you resources and things to look at to do that. Most guys doing the course will make contact with their local library. Could be a BDA library if you've got remote link with them, or your local postgraduate institute, because you'll most likely need a library just for a journal access and things like that, and also to do your work as you would with any postgraduate program. But we can certainly steer you in the right way about finding the literature and what you need. We have the virtual learning environment, which we put other lectures and seminars on. We can do feedback assignment that way. So when you've done an assignment, we put like a lecture, recorded lecture that you can then watch back at your leisure. So we use that as a resource for remote webinars and other teaching that happens outside of your taught study days, as well as the face-to-face tutor groups. So I hope that answers your question, but certainly that induction day is fundamental to make sure that you have an idea about how we expect you to do an assignment. We break down questions for you, and we give you a good guide over those first couple of assignments as to how that works. So I hope that answers that question. There's another question there from Scott, a little about the facilities used for hand-on sessions that you described. That's where the pig's head. So Scott, all of the hands-on teaching has traditionally been done at Lundeck, and we would envisage that for you guys, predominance of that's going to be in a year's time for the diploma year. So Lundeck is based by Waterloo in London. For those of you that aren't London-based, many of you may have been there before. So it's a very good operative environment to do hands-on operative dentistry. There's lecture rooms there. There's mannequins. You can prepare teeth. We can do surgical work there. You can work on, as you say, pig's heads. So that would predominantly be for something like the perio module in the diploma year, when you would do crown lengthening procedures, maybe regenerative work around soft tissue work and that type of thing. So all of that would be undertaken at Lundeck, which is our normal place to do it. But I hope that answers your question there, Scott, as well. I'm just trying to fish through these as quickly as possible. So Hira's asked about the tuition fee for overseas. Yep. So Hira, that doesn't change actually. So we don't apply the same rule as universities do, whereby our admission fees are different to yours, whether you're UK or overseas based. So the fee remains the same. One important thing I haven't mentioned actually is I know a number of you that have already applied for the course. Not all of you are FGDP members. Without wishing to insult anyone, to not be an FGDP member and do this course is madness. To be an FGDP member, I think it's about £300. But if you are a member when you apply, you have £1,000 taken off your course fee. But I know a couple of you, I think, have declined to become a member, which is absolutely fine. You don't have to be a member, but your course fee will be greater because you're not an FGDP member. So by spending £300, you actually get 700 back otherwise, essentially. So it's a kind of a no-brainer to become a member from that respect. But tuition fees are the same, so it doesn't matter whether you're overseas or UK based, they remain the same, and that's because we're not a university. So I hope that answers that question, Hira. Vishal, I hope I partly answered your question earlier on. So Vishal is very kindly joined us from Australia, which I'm sure the time is less civilized to ours.
Morning, Vishal.
Yeah. So it's 3 o'clock there, goodness. I'm grateful for you spending your morning with us, Vishal. Yeah, so you asked about the Friday group meetings. So that would be, I think that would be difficult because from your point of view, the face-to-face stuff obviously needs to happen from that point, but that would happen face-to-face. That's going to mean travel. I don't think you can do those remotely, if I'm to be honest. Now, the remote learning, as we talked about, as I alluded to with the thing, that's recorded. So as long as you can evidence the fact that it's been looked at, there is not an issue for you to do that in a different time zone, I don't think. But the face-to-face stuff is going to be difficult to escape. And I know historically, those that have come from Denmark or the Philippines or other places in Europe, they've always come over for that face-to-face element of the teaching. And obviously that's the presumption that it's very difficult to do the proper case discussion and things like that without being face-to-face. So obviously that eliminates the time zone issue. But for the remote sessions that you might be doing, I don't think there's an issue in you doing those in a more sociable hour, given that they're recorded and accessible to you after the actual delivery from a live perspective, if that makes sense. Phil, have you got anything you want to add on to that?
No, not really. It is difficult. I'm very happy to nip across though, Vishal, if you want any. I'll have to run it by Isha at the FGDP to check that will pay for me. But I've evidence now that I've bagged it before you, Nick. All right.
I know. Yeah, fair enough. So I think that answers all the questions that everyone has answered. Unless anyone's got anything else that they might want to start typing now. We'll hang on a second just in case anyone does. I think otherwise.
For Emily or Dan?
Yeah, for any of us. Yeah, Emily and Dan are still around very kindly. So if anyone's got any other questions they want to direct to anyone specifically, we'll just hang on a few moments to give you a chance to answer that. Just to give you a chance while you might be typing. So for those of you that Phil and I have already spoken to, I know I would have said there may be other queries that crop up after this, and if you just let Isha know, we'd be very happy to speak to any of you on the phone, whether or not we've done that before. But if any of you feel the need that you'd like to discuss with Phil or I personally about issues or any other questions that don't fit into what we're doing at the moment, you just need to let Isha know, and she'll pass on your details to us, and we'll give you a call so we can speak over the phone if there's anything else that we can clear up. But I hope this afternoon has given a bit more detail, and so put the meat on the bones of the course, about what it entails, as well as the assessment side of things, which is often one of the concerns at the start of the course. And we would hope that we'd be in a position to meet you all for the induction module in September. Scott, the tutors are allocated randomly. You'd find out from that as we would on that first day, on the induction day, which is due to be September. What I would say about that is, because of the COVID situation, we're likely to try and make sure that Isha sorts all of that out, but you're grouped regionally, which means that obviously you have to travel less far. So as Phil has already said, Phil is based kind of northwest, I'm kind of southeast. There'll obviously be other tutors around as well. So we'll try and make sure that we minimize everyone's distance to travel in that regard. So that's the only other aspect. But that would normally be told to you when we see you for induction in September. No one else is typing and I can see. Phil, anything else you want to add?
Nick, sorry, I think we've got one more question from Sarah about MPROS.
Forgive me. Thank you, Isha. Is that further up? Let me just have a quick look. Yep, sorry, Sarah, I missed that one, and my apologies. So Sarah just asked me about the MPROS. So I would say yes is the answer. You understood that right. You can't sit for MPROS just after a diploma. So MPROS now with the Royal Colleges, it does depend which Royal College you do, and they do change their guidelines quite a lot. So with the MPROS exams, that's a specialist exam, would normally be undertaken after two to 2.5 years of a full-time MCLIN Dent, would then allow you to be eligible to sit the MPROS exam with Royal College of Edinburgh, London, or Glasgow. So normally all of those would have done a master's degree. So if someone hasn't done a full-time MCLIN Dent, they can still do that with a master's degree, but they have to evidence their training. And I don't think you would have done enough with a diploma. They will want the scientific background that's given to you with a master's program, because nearly everyone else doing that exam it has done a master's degree. So I think you could try with a diploma. I think it's unlikely you would have been accepted. I examined for Edinburgh in this regard for MPROS, and I've never seen anyone there without a master's degree, because nearly all of them do that as part of their induction to that exam. So you just have to check the Royal College guidelines, because they change all the time. But I think you'd have to do a master's to then be eligible. You then apply, and then they assess your training and what you've done, which clearly would include the certificate and the diploma, to then see whether or not you've done enough. The other issue you said certificate, yeah, other than the 6 tutorial days, the online session, so there's the 6 tutorial days, there's also 7 days of online teaching, the remote learning. But I think it's likely that the occlusion module, I touched on this earlier, would probably be face-to-face, again, being COVID dependent, because that's traditionally something that we have done face-to-face rather than remotely. That's 2 days occlusion, and we would expect at least one of those to involve face-to-face, so all of us getting together. But that's planned at the minute for March. So clearly we don't know where we're going to be COVID-wise, but we would hope, and Phil and I talked about this earlier, that we would be in a position to deliver that face-to-face. So although the remote learning and lecture-based stuff can be done remotely, the induction and the occlusion and all of the diploma year, we would expect to be face-to-face, as we touched on earlier on, which again, I hope that answers the two parts to that question. So no one else seems to be typing. Isha, unless you correct me, I don't think I've missed anyone else. Thanks to everyone for joining us, especially to Emily and Dan, and I think especially to Vishal, actually, given the time it is in Australia. Thank you for taking the time. And Vishal, obviously, there's other things you need from us, just let us know. If no one else is typing anything else, Phil, do you have anything else you want to add?
Just no, guys. My advice to you, obviously, there is a marketplace out there in a business term of people who are wanting to get you enrolled onto their course. Have a good think around. I'm sure Emily and Daniel would be happy to answer questions, but if you put them through Isha, that you might not want Nick and myself to be aware of, but from a purely financial point of view, what you're getting for your money, etc., as well as what the certificate and hopefully diploma and then the masters will do for you. I think you'll be hard pushed to find a better course. And I know I'm got a vested interest in this, but having been through it myself and having quite a good awareness, especially around the Northwest, there are 1 or 2 courses similarly based. I genuinely think you'll be hard pushed to find a better course. Spiel over with.
Isha, is there anything else you want to add on for us?
If you guys have any questions, feel free to email me and I will reply to your queries. Nick, there's one more question that's come through right now about masters. So,
just have a look there.
And just think, when you say master for specialty exam, is that MSc year?
Yeah, sorry, so Mohammed, forgive me, I didn't make that. Sarah asked the question relating to the diploma that we run, and then the masters that you'd be eligible for, but we don't do. FGDP has nothing to do with the masters year. They just recognise our training for it, be that Kent or Peninsula or wherever. So for those that want to do specialty training, so that's a common question, and then that's a different subject. So as an example, one of Dan's colleagues who was in my tutor group with Daniel, he finished the diploma. He then applied to do restorative training, and he got straight onto that. So he's now finished his diploma. He's done an MSc. He's now doing a 5-year restorative training program, and that's what he wanted to do. So clearly the program allowed him to enter his specialist training. Now that's different to the question that Sarah asked, because essentially Sarah was asking me, would the diploma and then a master's allow her to sit the Royal College exam in MPros? So the MPros exam is a specialist exam that entitles you to go on to the specialist lists in prosto or perio or endo, depending on which one you sit. So it's different to fellowship that you sit with restorative dentistry. It's a monospecialty, it's whichever one you do. And you are able to be eligible for that exam if you've done postgraduate training, which would include certificate, diploma, and a master's. It may also require other things. Sometimes they want a hospital placement. Sometimes they might want house jobs. So it depends on the nature of the application. But if you are successful in that exam, you are eligible to go on that specialist list. But you must be able to show equivalence to those graduates that have done a formal 2-year MClean Dent and then sat that same exam. So I hope that answers the question. So I wouldn't want you to think that you do the diploma and then you can apply for the specialty exam, because I think there's a chance that they would say you're not eligible. I think if you've done the master's and you've got some other things on your CV, I think there is a chance you'd be eligible, but you must look at the Royal College guidelines, because Scotland, Glasgow, Ireland and England all differ, and they do also change them. And being an examiner in Edinburgh, I'm speaking predominantly from the Edinburgh experience that I've had over the last few years. But I think the diploma and their masters would be a really good thing on your CV to have for that. It would depend on what other aspects you've got to ensure you've got parity with other postgraduates that have done perhaps the more formal pathway, if that makes sense. So I hope that answers your question with regard to that. But again, just to reiterate from Phil and I, if anyone's got issues or queries, just pass your details on to Isha and we'll be very happy to contact you if there's any other queries that you've got.
I would like to add, thanks Nick, Dan has kindly offered further support as well. So if anyone has any questions they want to speak with Dan about, please forward them to me and I'll proceed.
Okay, great. Should we wrap that up then, Isha, if everyone's happy?
Yes, seems like no more questions are coming in. So yeah. This session is recorded as well. So if anyone wants to go back and listen to this session or this question and answer, we will be sharing it on our social media platforms next week. And you guys are more than welcome to go and listen to the recorded session. Thank you. Shall we end the session now, Nick and Phil?
Great. Thanks all. Yep. Thanks for taking the time, everyone.
Good night, Michelle. Get some sleep.
Yes, night, Michelle. Bye, everyone.
Bye-bye all.
Bye-bye.